Chair recognizes gentleman Mr. Latta for 5 minutes.
I thank the chairman. I bring before the committee today H.R. 1215, which relates to Section 2953 of the Health Care Law. My legislation amends Title V of the Social Security Act to convert funding for personal responsibility programming from mandatory spending to an authorization of appropriations. This bill will also rescind any unobligated funds. I am extremely troubled by the fact that Obamacare put in place programs and spending that bypass Congress and gives full control to the administration. Section 2953 establishes state grants for personal responsibility education programs to educate adolescents about adulthood preparation. The programs in this section are duplicative of existing government programs, and each program must be reviewed to ensure that taxpayer dollars are best utilized and funds are not being duplicated. I'm very supportive of this bill that will convert the appropriation contained in this section of $75 million for each of the fiscal years 2010 through 2014 into an authorization. Congress needs to be the ones that determine funding through the programs and determine if they are duplicative and determine this through the normal appropriations process. Making this change could potentially save $375 million over 5 years. This is a large savings at a time when we must get our fiscal house in order. Supporters of the program contained in Section 2953 will have the ability to ensure that they are funded, just like any other federal programs are funded through the normal appropriations process. Again, as I said earlier, my constituents back home want Congress to get its fiscal house in order by reducing the debt and the deficit and eliminating unneeded spending. There are many more savings by fully repealing Obamacare, as we heard during the legislative hearing on this bill. CRS has found that Obamacare contains $105 billion in direct implementation spending that bypasses Congress's normal appropriations process. Converting Section 2953 of Obamacare into an authorization and subject to congressional oversight is a positive step in cutting unnecessary spending and eliminating more bureaucratic control by the administration. I ask for your support of H.R. 1215. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen.
Well, thank you very much. I appreciate the gentleman for yielding. And just to go over just a few of these and to show you where we are in dollars. This is for the fiscal 2012 request. And we're looking for the Centers for Disease Control and Prevention. I'm just going to round these off if I may. $22 million teen pregnancy prevention. HIV school health, $40 million. Department of Ed, Promised Neighborhoods, $150 million. Substance Abuse and Mental Health Services Administration, Minority AIDS Initiative of $41 million. Health Service Resources Services Administration, Maternal and Child Health Block Grant, again, fiscal year 2012 request. $655 million. This is for family planning for teens to prevent pregnancy and sexually transmitted diseases. Title X, $327 million. Information screening on pregnancy, sexually transmitted diseases, HIV and AIDS. This program serves teens and young adults under the age of 20. Office of Assistant Secretary for Health Administration for Children and Families. We're looking at Office of Minority Health, another about $58 million in promoting safe and stable families, about $443 million. I appreciate the gentleman for yielding.